right. So good afternoon. Thank you so much for joining us. Our topic today, as many of it, is about vaccines during pregnancy and breastfeeding. And we're really excited today to welcome Dr. Avery to join us as our expert on this webinar to give us some background information and answer the questions that we have about the safety and efficacy of vaccines during pregnancy. Dr. Avery, do you want to go ahead and introduce yourself?
Sure, thank you. Thanks for having me, Carrie. I'm Dr. Anita Avery. I'm an obstetrician gynecologist. I've been board certified for more than 20 years. And for the last 10 years, I've really focused on medical education for both medical students and residents. And when I was invited to come join you for this topic, I was really excited because this is a topic I've always been a champion for in practice and with patients. And I'm happy to focus on this topic this afternoon.
Fabulous. Thank you. And I guess I didn't introduce myself. My name's Carrie Schreier. I'm an extension educator with MSU Extension's early childhood programs. I primarily provide parenting education and professional development for early childhood educators, but I also am very fortunate to get to be involved with this Michigan Vaccine Project grant. And I'm really enjoying learning so much as we've dove into these topics. I will go ahead and hand the floor over here to our background support to get that video shared.
I remember my mom always telling me, don't ask, don't tell, in regards to illness. For my Chinese family, being sick is a taboo, so we never talked about it. When I became pregnant with my first child, I find out I have hepatitis B. I was very shocked. Only then did I learn from my mom that she also has chronic hepatitis B virus, and that I probably got it from her. I know the transmission wasn't her fault, and yet I wish she had told me sooner. I decided I wanted to do motherhood differently. I was blessed because my OBGYN knew what to screen for and took precautions to prevent transmission from mother to child. My 2 children got vaccines at birth and then completed the 3 shots afterward. When they were retested at age 1 and again at age 2, the test came back negative. But my doctor told me that because I have chronic hepatitis B, I have a 25% chance of getting liver cancer. Will I be able to see my children grow up to adulthood? Will I have to leave them too early? I chose to be very open with my children about the virus, and I started reaching out to Asian communities too. When my children attended Chinese language school, I set up a hepatitis education booth for parents. My children manned the booth with me and talked to their friends about vaccination. Later, when they left home for university, they continued doing hepatitis B outreach on their own. I did too. I remember my son coming home during a school break and saying, hepatitis B is a silent killer. Testing is so important, and vaccination can prevent the infection. I told him, you got it. I am so proud of you. I used it to think my passion for preventing hepatitis B would live in me until I die. Now, I think it will live longer than that. Just be grateful.
Okay, so I think we just heard a video there from somebody who it sounds like benefited from the hepatitis B vaccine during her pregnancy, or her children did afterwards. Could you talk a little bit about that?
Sure, yeah, it's a very powerful story hearing how that affected generations. The hepatitis B vaccine is one that is widely available and recommended in childhood. So most adults that went through the routine series have been immunized against hepatitis B. But if that is not the case, or if the mother has the illness during pregnancy, there's the ability to protect the newborn upon delivery within the first day or two with an immune globulin to help protect that virus from being transmitted from the mother to the infant. And while a hepatitis B vaccine is not one that we necessarily routinely administer during pregnancy, again, because most of the adult population is already immune, if somebody knew about an exposure during pregnancy and or knew they were not vaccinated, it is one that is safe to get in pregnancy when needed.
And that's one that's also routinely given to infants, correct, at birth?
It's routinely given to infants, but of course it depends where that infant grew up and what vaccines were available there. And there are infants who did not get it if their parents declined on their behalf.
Great. We will be focusing primarily on vaccines during pregnancy and breastfeeding for adults, but I know sometimes we'll cross the line a little bit there. It's a little hard to totally separate those, right? Yeah. Great. If there's nothing else you would like to say about that video, we are going to jump into our questions. I do want to let our participants know that although we have some questions that were submitted in advance, we welcome your questions. You can either post them in Q&A or you can post them in chat. If you post them in chat, there's a little drop-down arrow. So you can either choose to send that question directly to us if you want it to be anonymous, or you can post it including your name in that. Your name will come up if you post in the chat box. So our first question that was submitted is just about that general safety of getting vaccines while you're pregnant or breastfeeding. I remember I have 4 kids, and I remember during my pregnancies wondering if it was a great idea to be getting vaccinated right now. Can you talk a little bit about that?
Sure. I also have 4 kids, and even though I've been through all of the scientific information, it's just natural to wonder about safety especially when you're carrying a baby and you're making decisions for 2 of you. The vaccines that we routinely recommend in pregnancy will focus on throughout the talk a little more are influenza, Tdap, and coronavirus or COVID-19. But overall, as far as safety of vaccines, there's really only one vaccine that is known to be unsafe in pregnancy, that is known to cause harm. And thankfully, that's a vaccine that we're not needing anymore. And that is the smallpox vaccine. That is the only one known to cause harm. There are some vaccines that we have questions about because they are based on something called a live vaccine. We can talk more about what that means, but those have what's called a theoretical risk, where based on the way the vaccine works, it's natural to have unknowns and questions about could that potentially affect the fetus, but no cases ever shown in those specific vaccines, things like rubella and varicella. With those few exceptions that I've just listed, the other vaccines are all either inactivated or consist of just a protein or something called an antigen, and do not cause any unsafe effects in infants or, of course, the person carrying the pregnancy and the mother. Oops, I think
there we go. See if I can unmute myself. It's only been 3 years we've been using Zoom all the time, and I still can't unmute all this quickly. Thank you for sharing that information. That's really interesting. I didn't realize there was only one vaccine that was really contraindicated that way during pregnancy. Our next question is about what vaccines someone should receive during pregnancy. And I know you touched base a little bit on what vaccines we're generally talking about. Can you just highlight those again, the ones that we should be getting or making sure we have received during pregnancy?
Of course. The 3 that we routinely counsel about throughout prenatal care and that patients will hear their physicians ask about throughout the pregnancy and make sure they're up to date are influenza, Tdap, which means tetanus, and diphtheria and pertussis is what those stand for, and coronavirus. Influenza is probably the one that most people are familiar with because the disease of influenza has been common enough that people have either experienced it themselves or know someone that's been impacted. And the illness itself is much more severe, has a potential to be much more severe in women while they're pregnant. They have a higher chance of getting pneumonia versus just the viral syndrome, and much higher chance of being hospitalized, including needing to be intubated. And that's just the maternal risk from being pregnant. We'll talk a little more about protecting the infant in the course of giving a maternal vaccine as well. But thinking just about mom for a moment, that's the reason we recommend the influenza vaccine during pregnancy, is just how much more severely ill women can get. The Tdap, which again consists of vaccination really against 3 infections, tetanus, diphtheria, and pertussis. The focus for pregnancy-related concerns is on that third one, pertussis, or the P in Tdap. Pertussis is better known as whooping cough. It is an illness that for most adults and even adolescents and children can be relatively mild, consisting of a persistent cough, or sometimes the cough isn't even the predominant symptom. And so an adult may be experiencing a mild case of pertussis and transmitting it or being contagious without recognizing that it's whooping cough. On the other hand, infants, when they are ill with pertussis, have a severe and even fatal outcome. And so when we're talking about the Tdap, specifically the pertussis component of the Tdap vaccine for moms, what we're really aiming to do there is protect that infant, especially in their first few months of life, when they are too young to get a vaccine administered themselves. And so by administering the vaccine to the pregnant person, the antibodies that pregnant patient develops get transmitted through the bloodstream to the unborn infant. And then when that baby is born, they've already got some of that protection. They've got some of those antibodies, so that when they're 2 months old, they're able to get their own vaccine. But in the meantime, they're protected from this potentially fatal illness. And we can talk a little more about that too. The third one that all pregnant patients are advised to have an updated vaccine for is the coronavirus or COVID vaccine. And as everyone can appreciate, those guidelines have changed so rapidly. And even this past fall, there was what's being called now the updated vaccine, is how the CDC refers to it, the updated vaccine, which protects against the original strain of COVID, as well as the newer Omicron strains of COVID. And so the recommendation now is that all pregnant patients have received 1 dose of the updated vaccine, regardless of initial and booster vaccines they may have received. That recommendation is, again, primarily for maternal health. Just like I talked about with influenza, pregnant patients will have a higher likelihood of getting much more severe course of illness with COVID, higher chance of being hospitalized, higher chance of ventilation, higher chance of maternal death. And there is now growing evidence that it also helps protect the infant. And we can talk a little more about that too. But to summarize, those 3 vaccines are the ones that are recommended during pregnancy: influenza, Tdap, and COVID. And we can talk about some others that are recommended before or after pregnancy as well.
Great. Yeah, I know my sister was pregnant during kind of the initial launch of the COVID vaccines, and things were changing so rapidly in terms of the recommendations for what you should do. And I know it can be confusing when everything is moving so quickly.
Yeah, go ahead, sorry.
It's okay. Just a couple of things I wanted to pull out of what you were talking about. I know you spoke a little bit about the Tdap vaccine, and I know that's one that is also recommended that people who are going to be around the baby get as well, right? So dad or grandparents or babysitters.
Absolutely. I almost think of it as the grandparent vaccine, because it's always a conversation we have during pregnancy. And you're absolutely right. Anyone in the family's life that is going to be spending a close amount of time with that infant, especially in their first 6 months of life. So that can include, like you said, babysitter or nanny, people that are going to come, often a grandparent or an aunt and uncle is going to come live in the home for a while. Anybody that's really going to spend a significant amount of time with baby, we do recommend that those patients also, that those family members are also vaccinated for Tdap, regardless of the fact that they'll have had probably multiple Tdap or tetanus boosters over the course of their life, but that they do have a recent update for that pertussis immunity to carry over.
Sure. Great. So we talked a little bit about what vaccines are recommended during pregnancy. We want to make sure that pregnant people receive. And you told us there's only one that's contraindicated, so they shouldn't get. Are there others that are just not generally recommended to be for people to be receiving while they're pregnant?
Absolutely. There's a few others that we do not routinely give during pregnancy. And I was differentiating them from smallpox, and that the reason we don't recommend them during pregnancy is because of what we call theoretic risk, meaning there's a valid reason to be concerned about what they could do to a baby during the pregnancy. And so we don't recommend them during pregnancy, even though there's no ultimately proven negative effects. Those are varicella, better known as chickenpox, and we abbreviate it MR for measles, mumps, rubella. Rubella is the one that we focus primarily on. That is an illness that all pregnant patients have an antibody test for to see if they're already immune, so that we know if they're going to be susceptible to the infection during pregnancy. And then we use that information to help make recommendations about whether they should get that MR vaccine after the completion of their pregnancy to help protect them in the future. So MMR and varicella are the most common vaccines that we commonly use in practice in adults, but don't recommend during pregnancy. There are others that are much less common or routine that we really take on a case-by-case basis, depending on the mother's baseline health, if she's immunocompromised, or if there's going to be travel to an area that has, for instance, yellow fever or typhoid endemic to it. But those are uncommon enough that we generally focus on varicella and MR. The other kind of close third would be the shingles vaccine, which most pregnant adults are not due for a shingles vaccine until later in life anyway. But it's also in that family of vaccines similar to varicella, where we don't recommend it during pregnancy because of the theoretic risk.
Okay, great. On that kind of same trend, is there like a recommendation, a timeline, if people are planning their pregnancy, that they should get their vaccines all in order before they begin trying to get pregnant?
I'm so glad you asked that. We love to see when patients are planning for their optimal health before they start their pregnancy, and that includes getting vaccines. The perfect timeline, the perfect window would be that the vaccine or vaccine series has been completed by 4 weeks before conception. That would be in a perfect case scenario, that if the vaccines have been completed at least 4 weeks before. However, as you can imagine, it happens plenty of times where patients are in the middle of a vaccine course or have just gotten their booster, and then lo and behold, they conceive very shortly thereafter without necessarily having been planned timing. In those cases, because we know the risks are only theoretic, we do not recommend any decisions that would terminate pregnancy based on that vaccine exposure, because again, there's no proven negative outcome on the infant. We recommend at least 4 weeks. Having said that, if there is a vaccine less than 4 weeks from the pregnancy, there have not been any cases that resulted in harm to the infant from that scenario.
Great. Yeah, that makes sense. So our next questions really kind of correlate, and I think you've answered this question several times, I think, but we're wondering, or the next question here is wondering about what effect those vaccines have on the fetus when mom gets vaccinated during her pregnancy, and if that does carry through to provide the baby some protection when they're born.
Yeah, I'm glad you asked a little more about that, because we touched on it briefly, but I think it's a very helpful concept as we think about decisions to go ahead with vaccines during pregnancy. There are different classes or categories of antibodies, and there's one category that's pretty unique in that it travels from mother's bloodstream to the fetus's bloodstream before birth. And when that baby is born, then those leftover maternal antibodies are active in their system, in the baby's system, for up to 6 months, anywhere from 2 to 6 months. And what we are looking for in vaccines like the influenza vaccine, for example, is that in the process of the mother developing antibodies during the pregnancy, those antibodies will then form during her pregnancy, get transmitted to the fetus, and then that infant still has those influenza fighting antibodies that you could think of it as inherited, that they gathered through the pregnancy, and that those will not continue to be replicating in the baby's system. That baby won't make its own new antibody. It just has that leftover from mom. And that's true for plenty of other exposures that we don't have vaccines for. It's part of how babies are naturally get part of their protection is from that ability of mom to transmit or convey those antibodies. But for infectious diseases such as influenza, though that is one way for baby to get it from their mom. They're not going to develop those antibodies on their own in their first 6 months.
Okay, that makes a lot of sense. Our next question really ties right into that. So if mom receives no vaccines, like we're looking at the flip of this situation, so mom's got no vaccines, are there still some immunities that are passed along to baby? I think you were touching a little bit on that.
Sure, any illness that mother has fought or had fairly recently during pregnancy or immediately before that they have an active pool of antibodies to may get transmitted to the infant, but it'll be a pretty small pool and not nearly as active as what we specifically vaccinate against.
Sure. So our next question talks a little bit about age. And I know when I had my last, I was tipping into that advanced maternal age category, and that affected some of the things I was recommended to do or not do. Is there any correlation with that with vaccines? That the mother's age might affect what vaccines she should or shouldn't receive?
There are no age-related recommendations for specific vaccines as it relates to pregnancy. We can maybe talk a little bit about, for example, the HPV vaccination series, which is for a certain age range of adults. But in general, the recommendations for vaccination in pregnancy hold true whether the pregnant individual is 16 years old or 46 years old. The one kind of qualifier I would say with that is with that advancing age in pregnancy, there's also that increased susceptibility to have a more severe illness. If nothing else, it strengthens that recommendation to, for instance, have the influenza vaccine, because pregnant or not, an individual that is 40 years old is more likely to get a severe course of the flu than if they were 20 years old. So nothing really specific to the vaccination recommendations or to the fact that there is what we call advanced maternal age in pregnancy, but more of a reinforcement of not only the safety of the vaccination, but the real recommendation for it in those later childbearing years as well.
Great. Yeah, that makes a lot of sense. We've been talking a fair amount here about pregnancy, and we're going to shift a little bit to some questions about breastfeeding. As you talked about the safety of vaccines while you are pregnant, are they equally safe when we're breastfeeding? Are there other concerns when you're breastfeeding and you're looking at vaccinations?
Yeah, excellent question. And we have these discussions a lot with our patients, because sometimes they've made a decision during pregnancy one way or another, and now the baby's here and they're reconsidering, can I still get the vaccine after all? They are equally safe during breastfeeding. If anything, if there were any concern about exposure, there's even less exposure during breastfeeding, because the amount of protein and antibody that is transmitted from an infection fighting standpoint through breast milk is even less than during pregnancy. So they are at least as safe during breastfeeding. One place where this conversation really got a lot of attention during the pandemic is with the COVID vaccine, because we were trying to balance, on the one hand, protecting mom, and yet having at the time unknowns about transmission through breast milk, and then that understanding of, while one is breastfeeding, we're holding that infant very close, and are they getting exposed to potentially that mother's active COVID illness. And so there was a lot of grappling with those different aspects and rapidly changing guidelines again in that realm. And the current guidelines for COVID, I'm focusing on COVID for a moment, but I think it's illustrative for the other vaccines as well. The recommendation is that if a vaccine is indicated during that breastfeeding time, that parent go ahead with the vaccination. However, if the mother is actively fighting an illness, and that could be true for a cold for that matter, but specifically for influenza and COVID, that they aim to have baby more than 6 feet away for a respiratory transmitted illness. And when that's not realistic, as in the case of breastfeeding, that the parent wears a mask. And so there's different ways patients can wear this. They can continue to breastfeed with a direct latch while wearing a mask. Other families will choose to pump during that interval and then have another family member feed the infant the breast milk through a bottle. So it's two pieces. One piece is there transmission through the breast milk? And the other piece is, by holding that infant close during breastfeeding, what kind of respiratory transmission is there? And the bottom line is that the vaccines are, at least if not even more safe, if there's such a thing, during breastfeeding, and that we do not recommend deferring vaccines while breastfeeding.
Fabulous. Yeah, thanks so much. It's hard to breastfeed and stay 6 feet away at the same time.
Exactly.
It's tricky, doesn't it? So speaking of the COVID vaccine, our next question, it was submitted by somebody who had decided not to get the COVID vaccine during their pregnancy, but now regrets that decision and is breastfeeding the baby. Is it okay for the baby, for the mom to get vaccinated now while she's breastfeeding? And if so, does that provide some protection through to the baby?
Sure. Not only is it safe, it would be a great opportunity. We often find that postpartum time frame is an excellent opportunity to catch up on vaccines that are needed. I mentioned rubella a moment ago. We have a habit and routine of reviewing with every new parent whether that rubella is needed now that they're not pregnant. And at the same time, we're often talking about COVID for all the reasons you mentioned. There's plenty of women who have decided against it during the pregnancy and now are willing to reconsider it. So it is safe from the breastfeeding standpoint. We're still learning more about what kind of transmission of antibodies and safety occur. We know, for instance, that when the vaccine is received during pregnancy, that antibodies for COVID are found in the umbilical cord of that infant upon birth. We know, for instance, that there's many factor higher amount of antibodies in a 6-month-old infant's bloodstream if their parent has received COVID during the pregnancy than if their parent received it after the pregnancy. We don't yet know how much, if any, active antibody would be transmitted through breast milk exclusively to the infant. And so for this time, what we can say with certainty is that the infant is being protected by having the parent protected, a concept we call herd immunity, where by having the population, including the parents and the family, protected, it's protecting the infant from exposure to the virus. We don't yet have certitude about how much protection is conveyed through the breast milk for a baby whose parent did not receive the vaccine during pregnancy.
Okay, great. On that subject of getting people caught up with vaccines or getting vaccinated, this next person shared that they were not vaccinated as a kid at all and have been working on getting caught up now that they're an adult, but recently found out they were pregnant. Is there any concern there for this mom in question?
Yeah, that's a common or not too uncommon scenario, especially as a lot of families have changed countries where they're living and the guidelines are different, and now they're catching up with what the local guidelines are. So we do run across this a fair amount. Because as we've talked about, all of the vaccines, with that one exclusion of smallpox, all of them do not have direct impact on the fetus. There is not concern from a standpoint of them having recent exposure and now conceiving. What commonly arises, though, is that they're midway through a series. Maybe they needed to get a 3-dose series for, let's say, hepatitis B, or all 5 for the Tdap series, for instance, and there may be 2 or 3 doses into series. We do have to look at each of those on a case-by-case basis, depending which vaccine and how far they are into it. In most cases, what we do is pause that series during pregnancy and pick up where we left off at the conclusion of the pregnancy. An exception to that would be if they are in a setting where they're actively exposed. So for instance, if that household member, like the video we saw, has hepatitis B, and that's just been discovered and they're midway through their series, we're probably going to recommend completing that series during the pregnancy. For most cases, we're going to say, all right, no harm done, with glad you're 2/3 of the way through. And then after the pregnancy, continue where we left off.
Just pause now and pick back up when we're done.
Correct. Yeah.
We had a question just submitted from somebody on the webinar about that COVID vaccine question. So if mom gets a COVID vaccine way before getting pregnant, so, several years ago or whenever we got their last booster, are there still antibodies that then circulate to the baby during her pregnancy?
It's a good question. The concern we have these days is that the newest vaccine was just released in the fall of 22, and that's the one that protects against the Omicron variant. Even with perfect retention of antibodies from an older COVID vaccine, it would potentially be either from illness or from vaccine from the original COVID variants and not have protection from the more recent variants. Having said that, there is some lingering antibody load, but it does fade pretty quickly, just thinking about the adult, let alone the transmission to the infant. It's really hard to say if somebody had the COVID illness 2.5 years ago, whether the antibody protection from that would still be enough to protect themselves, let alone their infant. So generally, we're recommending that regardless of past vaccine or illness history, that all pregnant individuals get again, what's called updated, CDC is calling it updated, we were calling it bivalent, the updated vaccine, 1 dose of that. If they have received it since September 22 when it was released, there's not a recommendation at this time to have it repeated.
Okay. Again, this is probably that window of we're learning so much and it's changing so rapidly. We don't always have some firm answers for some of these questions, I would think.
Precisely. Yeah, I would suspect the answer I just gave will be outdated within a year or less.
Yeah, things have been moving quickly. Our next 2 questions, actually, I'm going to lump these together about whether or not vaccines are harmful or could be harmful to developing fetuses or to cause birth defects within these developing fetuses.
You're asking about actual formation of the baby, correct?
Yes.
Like versus
I think
infection?
so, yeah, that's how I'm reading this.
Yeah, that's where that theoretical term I talked about, what the medical term when there's an agent, be that a vaccine or prescription medication is given and it causes malformations in the developing fetus, we call that teratogenicity. And the one instance where that's been proven to take place, again, is that smallpox. But for all other vaccines, there's either no pathway or mechanism for it to take place, or in the case of rubella and varicella, it's a theoretic concern that has never occurred. We can confidently say that all of the vaccines we use during pregnancy have no association with teratogenicity or with birth defects. Does that answer what you were with the?
I think so. Yeah, it's always a little hard to interpret other people's questions, but I think so. I think that's where we were headed. So if you are looking to get vaccinated during pregnancy, do you receive those vaccines at your OBGYN's office, at primary care office, or at a pharmacy? Where do you go get vaccines when you're pregnant?
Any of those is an option. In the state of Michigan, we're very fortunate to have a state-based registry. And even when vaccines are administered at pharmacies, that registry is now being updated. So what's nice about that is we don't have to worry about all of your records being in one place and not being visible to the other office or the pharmacy that's administering your vaccine. So technically, you can go to any one of those. Generally, what works well as a fallback is the place where you are receiving your prenatal care is probably your best bet. There are some primary care practices that do give prenatal care, and usually then they are also comfortable with answering questions about vaccines and with administering vaccines during pregnancy. And so that can be your location for your vaccines as well. So I think start off with where you're getting your prenatal care, whether that's at a primary care practice or with a OBGYN. And then from there are some practices that are more equipped to administer vaccines on site than others. And some of them will say, I recommend you get this vaccine, but I don't have it available here. Please go to your pharmacist to have that done. And so again, what I've really appreciated in the state of Michigan is that ability to know that it's all going to end up in that MICR, that Michigan registry, and be visible to that doctor, even though it was administered at the pharmacy.
No more carrying around our little green vaccine cards.
Right.
I remember from when I was little. And as a mom, it's so nice to know that they'll just populate into that automatic registry and I don't have to try to keep track of. I barely know how tall they are and how much they weigh, let alone when they got whatever last vaccines I'm being asked for on some form. So it's always good to have that registry.
And I guess as I think about that question from another perspective too, I think if you are pregnant and you seek a vaccine at a location other than where you're getting prenatal care, such as a pharmacy, just to be sure to let them know that you are pregnant. They generally have screening questionnaires that ask that, but just to make sure they are aware of that in case it changes any of the recommendation.
Yeah, that ties very much into our next question here. That was also an audience question. This person shared that they're traveling this summer and they don't say where, but they abroad apparently because there's travel vaccines being recommended. They just found out they're pregnant. So are there, I know this is a very broad question, but are there some specific travel vaccines that we should be concerned about receiving while we're pregnant, or is it better to get the vaccines than the exposure?
Yeah,
decisions.
It is such a specific question that In the office setting, we're commonly having to pull up CDC maps and recommendations, really like what country are you going to, how far along will you be in your pregnancy, and then looking very specifically at what is due. Several of the travel recommended vaccines are what we call immune globulins, where they're protecting against an active exposure rather than building antibodies up in advance. The common vaccines that are at least considered, depending on the part of the world that the travel is to, are typhoid, yellow fever, and hepatitis A. Hepatitis A is now a routine pregnancy in children in the US, but a lot of adults in the pregnancy years may not have gotten the hepatitis A vaccine. So that's one I would especially focus on. But it comes down to where you're going and what's what we call endemic there. Often either a primary care or obstetrician gynecologist will be making those recommendations in concert with recommendations from the public health department and the CDC recommendations. I'm happy to try to take a stab at anything more specific, but that's the best I can say without knowing,
Yeah, no, and we don't know what specific country or vaccines. I appreciate the effort there, though. I know it gets complicated. I used to travel. My dad lived abroad. I used to often travel to go see him. And I remember trying to keep track of what's recommended for different countries. It gets pretty complicated.
Yeah.
So our next question again is going back to those adult vaccines. If my newborn has not been vaccinated yet, and I didn't get vaccines when I was pregnant, should I be shielding them from visitors that I worry may not also be vaccinated? So I'm assuming maybe we have some family members here who are perhaps vocal about not vaccinating. Are there concerns about having baby around those people?
Yeah, that's excellent that even in the setting of not being vaccinated, thinking about what's the maximum we can do to protect. And as an obstetrician gynecologist, I'm often looking to my pediatrician colleagues for the recommendations on how long to wait for things like taking baby to the grocery store and things like that. But in general, the first set of vaccines that infants can routinely start is at 2 months, with the exception of hepatitis B that they get their first dose at birth. But some of the other common vaccines start at 2 months of age, and then the next set of vaccines starts at 6 months. So those are good markers that the first 2 months is when you want to be especially cautious with shielding from exposure to viral illnesses. And then depending on the time of year, when early fall, when influenza is more prevalent, you probably want to use extra caution all the way to 6 months of age. Again, I give that with a hefty dose of deferring to the pediatrician for the specifics.
Yeah, sure. Absolutely. We always encourage people to refer back to their practice providers, whoever it may be that's appropriate in making these decisions. So there's a question here that stood out to me, and I wanted to make sure to highlight this before our time ticks by here. This person says, I have A negative blood type, so A negative, and have been told they have to get a shot called RhoGAM. Is that a vaccine? And then could you talk a little bit about how a vaccine, like maybe a COVID vaccine or a flu vaccine, is different from a RhoGAM shot? Can you talk a little bit about that?
Sure, absolutely. And in fact, that kind of comes back to what I said a few minutes ago about an immune globulin I mentioned in passing. So RhoGAM is not something we consider a vaccine. It's something that it's derived from human blood. It's not an inactivated virus or RNA fragment or anything like that. And the purpose is to bind up antibodies that the mom may be developing if her infant has a different blood type than she does. So if this question was somebody was A negative, if their unborn infant is A positive, for example, and then that mother potentially is going to make antibodies against that A positive blood type. Administering this shot of RhoGAM binds up any Rh positive cells that have been conveyed from baby to mom so that she won't make antibodies. So it's binding up exposure at the time, in contrast to a vaccine, which is preventatively building up one's own antibodies in preparation to fight off a future illness. Is probably how I'd differentiate that. Another way to help think about that is this varicella that I've talked about. We said the vaccine is not routinely given in pregnancy. There's some theoretic concerns. It's not one that we give. However, if a pregnant patient is exposed to chickenpox, say her 2-year-old comes home from daycare and has chickenpox, and this pregnant individual is pregnant, especially in the 3rd trimester, to help protect her from the chicken pox she's going to be exposed to by her 2-year-old, we can give her varicella immune globulin to bind up anything she's about to be exposed to. So that's the closest comparison and contrast I can draw with RhoGAM, that it is a protection, but it's not from an infectious illness, and it's at the moment versus making preventive antibodies in the future.
Okay. Yeah, this is fascinating for me. So when we're vaccinating against something like COVID, flu, whatever, we're preparing for that exposure down the line. But with RhoGAM, and I'm a negative blood type person, so I got these shots, so I'm so interested about this. With RhoGAM, it's working like immediately to help protect that exposure from the cells in our body, right? That the baby might be creating or exposing our body to.
And it's blocking you from making antibodies that could be unsafe for your infant or a future infant. Whereas vaccines are stimulating us to make our own antibodies against future exposure.
Okay. That's so fascinating. It's really interesting to learn more about why it was I had to get these shots during my pregnancy. Great. So I'm just looking ahead here through our questions. We just have time for maybe 1 or 2 more questions, and then I'll have you do a wrap-up statement before we finish. One of the questions here that kind of also popped out to me, and I know that this will tip a little bit into pediatrics, but hopefully you can help us just provide a little guidance. This person has an older family member that's encouraged them not to get any vaccines at all while they're pregnant or give their baby vaccines, and said that it's better to help baby just develop natural immunity. So what would you say to somebody who is planning on not vaccinating at all because they want to build on this natural immunity? I remember this being a big debate because my oldest is old enough that the varicella vaccine was just coming out. And so there was this big discussion about whether or not natural immunity is better than vaccinated immunity.
It's tricky, and family members and people in your life will have very set ideas. And I think the most helpful thing is to ask questions, understand where they're coming from. So when they're having that idea about wanting to avoid vaccines and relying on natural immunity, really finding out what the concern is, what the potential fears are, understanding those, and then being able to speak to those. I think that from a public health standpoint, where we really worry is that natural immunity includes the potential to get severely ill and even die from the illness. That is unfortunately, I hate to use the word natural for that, but that is the natural outcome for, depending on the illness, a certain percentage. So for some illnesses, if an infant gets that illness and they're unimmunized, the fatality rate can be as much as a third, right? 3 out of 10 would succumb to that illness, and move that to less than 1% with a vaccine, for instance. So that's where I would really have a concern, that it's a lot of playing the odds. It's possible that the infant will build their own defense against what they're exposed to and develop natural immunity and survive that. But it's just really challenging when there's known ways to prevent these illnesses that could lead to tragic outcomes. And I'm just really wanting to be proactive with those. I don't know if that gets at what you're.
Yeah, I think so. And again, it's always a little bit challenging to interpret other people's questions, but I think the question here is really gearing towards that idea of what do we say when somebody is talking about natural immunity? And I really like the explanation that you gave there, that a natural immunity might occur, but it might come with a consequence. And there can be some pretty big consequences to a lot of these illnesses. So they might end up getting immunity, or they might end up with permanent lifelong hearing loss or some other consequence from having been ill. Yeah. The hearing loss sticks out to me because I have a friend who has hearing loss due to.
I was going to say, I mean, I had a friend growing up who had hearing loss because of what he contracted as a 3-year-old when he was unvaccinated. And yeah, it's lifelong.
Yeah, I think we often don't think about those long-term consequences of not having these vaccines that may be in between natural immunity and a more drastic consequence.
Correct.
Yeah. So just a few more questions here. And on that line of what can we say to people when they have questions, this person says that my daughter just found out that she was pregnant, and she has so far opted out of receiving the COVID vaccine. So she's newly pregnant. She's not gotten vaccinated for COVID. And the person here asking the question, the mom, says, what can I say to her that might help her reconsider her decision? Like, what information are we providing to patients during pregnancy as they try to make this decision?
So this is the mother of a pregnant individual, right? Wondering what they can say.
Yeah.
Similarly, as you alluded to a moment ago, it's often counterproductive to go immediately to the most severe consequence and so on. And so sharing information, sometimes sharing things that you've read that demonstrate the higher severity, the higher chance of being hospitalized, expressing concern and worry, expressing that it's not only about protecting the infant, but the actual individual carrying the pregnancy, that the best way for this infant to have a healthy outcome is for the individual to not have a severe respiratory illness in the case of COVID. So I think, again, just asking what the concerns or fears are, sharing information. If you come across sometimes it helps to see it objectively somewhere else that they can read it for themselves versus hearing somebody translate it. We've got, I think, a couple of links in the chat. We can share some more, but pointing people to information from places like the CDC or the American College of Obstetricians Gynecologists. And so it's not me, the aunt, saying it, it's this is what I read type of thing.
Yeah, there's so much information. And I think one of the best things we can do as consumers of information is learn to filter through all of this stuff that's coming at us and identify what's accurate information. Yeah,
Right.
knowing our sources is so important.
Yeah, and that's an excellent point, Carrie. It goes the other way. So sometimes a decision like that will have been made on something they read, an article that says it causes infertility or some such, and being able to say, can I look at that? And then look at that together and find out like what in here are we relying on is accurate and what do we need to look into more?
Yeah, that being curious and being open to look into information is so important. Okay, so I think I've got maybe just time for one more question. If anybody else has something to share in the chat, feel free. But this next question, and it's something that we've touched base on a little bit. This person's a teacher, so around lots of germy children, and are especially concerned about their exposure to those germs now that they're pregnant. Are there any particular vaccines that you would recommend that somebody who works as a teacher or in healthcare, who's around a lot of sick people, should be sure that they are either getting when pregnant or when considering getting pregnant?
Yes, that's somewhere the same three that we've talked about at the top of the hour are still recommended all the more, the pertussis, influenza, and COVID. You can imagine all three of those would be at higher risk of exposure in daycare. But that kind of a setting, somebody who works with young children or in healthcare, for instance, would be all the more reason to consider getting some of those vaccines ahead of pregnancy if they have that time, if they're not already pregnant. So the MR for rubella and measles, as well as the varicella for chickenpox, those are ones that we don't routinely administer during pregnancy and would be available as part of that preconceptual planning timeline. So I would strongly recommend those before their pregnancy if they can. And if not, if they're already pregnant and they're just hearing this information now and wishing or wondering what they can do, it's still hand washing. And then if there's anything suspicious, any rash that's undiagnosed, they can help protect themselves by, depending on the virus, wearing a mask, close hand washing, frequent hand washing, not touching any open sores, those kind of things to try to help protect themselves while they're pregnant.
Great. We have our last question here. So speaking of those vaccines that we maybe weren't able to get during our pregnancy, how soon after you give birth could you get caught up on those vaccines?
I'm pausing because immediately is my reflex answer. And I'm just trying to think if there's any that we have to wait. We routinely give vaccines like MR, varicella, flu, Tdap. We're routinely administering those as soon as the first day after delivery. In the moment, I can't think of ones that we would delay, but those are the standard ones we are able to give at 1 day. We'll often wait till the day they're leaving the hospital for convenience. There's many vaccines administered between 1 and 3 days after birth.
Okay. Yeah, I suppose when you're there and you're just have given birth and you have people paying attention to you and your health and wellness, now is a good time to be looking at those sorts of things.
Exactly. And having said that, if it's something where they've been home for 2 months, or excuse me, not home, but they've left the hospital 2 months ago and are now reconsidering, it's never too late either. I wanted to add something from an earlier question that some of your thoughts prompted. You had asked about birth defects, and then we later talked about each of us remembering children who had lifelong effects from illnesses when they're infants. I guess the other thing I didn't really say yet is in a case like MR, where we've talked about not giving the vaccine during pregnancy and trying to protect against exposure, the actual illness, rubella, without vaccination, if the mother has the illness during her pregnancy, that can cause birth defects in the fetus. And I neglected to mention that. So there are some of these viruses that on their own can cause birth defects that are not caused by the vaccine.
Should someone become infected with rubella, then it's dangerous for
Right.
the baby. The rubella is the one that stood out to me. I remember from my pregnancies and having subsequent children that we were concerned about that.
Yeah.
Great. As we're wrapping up here, is there anything else that you would like to share in our last few minutes?
Nothing additional. I just really appreciate the questions and I think the opportunity to get vaccinated before pregnancy when that planning exists. And then just really, we think about pregnancy and the lead up and the recovery as a time to focus on preventive health. And it's just a great chance to kind of revisit what may be needed and what you're due for. And definitely encourage you to ask questions of your providers. And I think preventive health is that level 1 prevention that we're all know where we can make the biggest impact long term.
Yeah, I really haven't given much thought previously to the idea of this period during pregnancy and pre-pregnancy as a time when we can focus on our preventative health. But we certainly want to be able to bring baby home to the most healthy and home environment that we can. And I feel like we've certainly seen those concerns over the last few years. It surprises me. We're saying years now. I feel like it hasn't been quite that long since COVID started.
It is funny to think about, not funny, but strange to think about that as a 3-year timeline.
How long it's been.
Yeah.
I really appreciate your time very much today, Dr. Avery, and I will direct everyone who's joined us. We have a link in the chat to a Qualtrics survey that's a post-test. We do appreciate your time completing those links if you haven't done so already. And I'll leave this up just for a minute so that you can grab those links if you need to. If you're looking for any other resources or information, I provided a few links to the Center for Disease Control's recommendation regarding vaccines, as well as the American College of Gynecology and Obstetrics. And of course, we certainly encourage everyone to speak with their own providers. So your own OBGYN or your midwives, and talk to them about the care that you need in order to be prepared and ready for your baby to join us here. Yeah, so thank you very much again for your time. And we will be back again in June with another one of these webinars talking about vaccines. If you're interested in any of the previous topics, for instance, we didn't get into talking about many of the specific vaccines in detail during this webinar, but you can find some past webinars that will dig into a little bit more detail on some really specific vaccines. So again, thank you so much for your time, and I hope you get to enjoy some lovely weather this week.
Thank you, everyone. Thanks for having me.
Yep. Bye-bye.